Hi guys! In this video I'm going to talk about tibial stress fractures, and we're going to look at three types. We're going to look at the posterior medial, which is, let me show you, in this area along the medial side of the bone and also right at the back there. We're going to look at the anterior tibial stress fracture, which is on this ridge of the bone that you can feel it somewhere along that usually. And we're going to look at the medial malleolus, which is this bony prominence. That's the third place that they commonly get stress fractures at. Now we're going to look at why some of them are classed as high risk stress fractures and others as low risk. We're going to also look at what causes them and how do you what does it feel like when you have one, and also at what treatments are useful for it. So those three types of stress fractures has very different healing times, and also with regards to whether they have conservative treatment or surgery is advocated. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries. Have a look at the description of the video if you want a link to our website. Okay, so high risk versus low risk stress fractures. What's the difference? Low risk ones are ones that heals quite easily, and they tend to recover more quickly and athletes can get back to training more quickly. The high risk ones are the ones that if you don't treat it well or carefully at the beginning, they tend to not heal and they usually need surgery, and they can take a very long time to recover. So of these three stress fractures that we're going to discuss today, the medial tibial stress fracture, which you feel along this line or in the back of the tibia, so it feels as if it's kind of dull calf pain, is a stable one. And the reason for that is, if we think of the bend of the tibia when we walk, it's natural that the forces of walking and running kind of compresses that part of the bone, so it's easy for it to heal. It also has a bit better blood supply than the rest, and therefore it heals more easily. Both the anterior one that comes on this ridge of the bone plus the lateral malleolus, they tend to be high risk stress fractures, which means they don't heal that easily, and if you don't treat them carefully at the beginning, they tend to not heal and you need surgery, and they can take many, many months to heal. To give you an idea, the medial one along this line takes about 4 to 8 weeks to heal, that athletes can get back to their running sports and ease back into running. It takes about 3 months to get back to full running with them. This one takes between, if you're doing conservative treatment where you just offload and slow return to sport, anything between 8 months and 12 months. If you do go the surgery route, especially when it's got a fracture line that's not healing, then they put a pin into the shaft to, just like a normal tibial fracture, and it still takes 4 to 6 months before an athlete can get back to full sport. So you can see why it's important to try and catch them early and also do the correct treatment for them. Okay, so let's look at how can you tell if somebody may have a stress fracture. Well, the first thing is that it has to be an athlete where there's a high suspicion of a bone injury. So we think of people who do a large volume of sport. But this can be misleading because sometimes you can get this type of stress fracture even in athletes who doesn't do that much. So usually it'll be athletes, runners who run more than 100 kilometers per week. But there are definitely cases of people who just does 30 to 40 kilometers a week. And it's usually because then there's another factor that affects the bone health. So if we think of other factors that affect it, it can be vitamin D deficiency, because that delays, if you don't have enough vitamin D, you can't actually absorb your calcium. And calcium is the main building block for bones. So that can cause, even on a low volume of sport, that can cause the bone not to heal and develop a stress fracture. Also, if you're not eating enough. So either you're just training a large volume and you're not replacing all the energy that you're losing, or you are restricting your diet because you want to be losing weight, and you're just not replacing enough. Then the body doesn't have enough to repair the bones. So that can put you at risk, even at a low volume of sport. Also, if you've got other hormone conditions, like for instance, if something's affecting your thyroid hormone, that can affect your bone health as well. So stress fractures happen when the body can't repair the bones quickly enough before another training session. So those are all things that you need to listen to in your athlete's history when they tell you, that can already set off alarm bells that this person may have a stress reaction. The other thing for females especially is if they tell you that they've not menstruated regularly over the last few months, or even not menstruated at all for several months or years, because that usually shows us that there's an energy deficiency, because the body's shutting down menstruation to save energy, which means that the bones can't repair properly. So it's important to ask about those things. Now, the pain from a stress fracture can be quite difficult to pin down. So it can feel like just general calf pain, or like a stiff ankle, and there may be a little bit of swelling. But when you examine it, there has to be tenderness on the bone. If it's only the muscles that's sore and there's no tenderness on the bone, it's likely not a stress fracture. But like the medial one along this line can feel very similar to shin splints. But the difference is with shin splints, you have it over an area of about 5 to 10 centimeters that you feel the pain and the tenderness. Whereas when it's a stress fracture, it's usually an area around smaller than 5 centimeters that is really painful. Also, it's only a stress fracture usually that gives you pain on the bone at the front of the tibia. We're not talking in the muscly bits there, we're talking on this bony ridge. Now for the inside ankle, the pain from a stress fracture there can feel very similar to an ankle sprain. So it's important to scan for those things. But if you suspect that it may be a stress reaction in the bone, then an MRI scan is the best investigation to rule that out. X-rays does not show up just stress reactions in the bone. It also misses quite a few of the stress fractures. So only MRI scan can show you that. Because remember, before you get a proper fracture of the bone, you always get the stress reaction area where you can see on an MRI scan the bone is not totally happy. You can see differences in how it shows up. And if you can catch it at that point, there's much bigger chance that you can recover more quickly and that it won't become a problem in the future, that you have a malunion of a fracture. So that part is really, really important. Now, if we think of how we treat these, so it's always a period of deloading, because remember, it's overload of the bone. So you've now got to take some of the load away that the bone can actually recover. What that means will depend on how much pain you have. So if it's a stable stress fracture or a low risk one, you may be able to walk without being immobilized in anything, as long as you can do it pain-free. If it is painful to walk, it may benefit you to immobilize it in a boot for a short period of time while you offload it until you're pain-free, and then you can go to low-load activities. Or even for the stable ones, the medial ones, wearing a brace that braces all the way, not just the ankle, but all the way along the tibia while doing your sport has been shown to be effective for that, to allow it to recover. If it's the high risk guys, then you usually need to have it properly immobilized in either a cast or a boot and non-weight bearing for a period of time to see if it can grow to get back together. And then the next step is, well, together with that, it's really important to also figure out why this happened. If there's any nutritional part that you need to eat better, or you need to learn about eating better, then that needs to be addressed as well, because you cannot heal if you don't have the right building blocks in your body. If you're vitamin D deficient, that has to be corrected with supplements so that you, again, can repair the bone. And also, it's worth testing your hormone levels for your thyroid and things, but have a chat with your GP because they can help you with that. Then, if that offload period helps to settle the pain and you can get back to activities, it's important to first ease into low impact stuff like cycling or swimming or running in the water. And once you can do those things pain-free, people can usually ease back into their sports. Now, at the same time, you can do all your strength training, like strengthening the calves, strengthening the rest of the legs, or whatever may be needed for you. A physiotherapist can help assess and decide what is specifically needed for your case. For the guys who have the stable or the low risk stress fractures of the medial tibia, like I said, usually 4 to 8 weeks where people can start easing back into sports. Still takes about 3 months to get back to full running usually. If it's the anterior one, which is high risk, if you're doing conservative treatment, 8 to 12 months. If there is a fracture line and they see that it's not healing, then you may require surgery, and usually return is 4 to 6 months then. If it's the medial malleolus, there's a little bit of an argument about what's the best treatment. The advice at the moment is if there's just a stress reaction, no fracture line, then conservative treatment of just offloading dramatically and then slowly reloading it through activities. But if there is a fracture line, even if it's not displaced, they reckon it's better to do surgery because it usually doesn't heal, and that just reduces your recovery time then. But it's important to work with a good doctor who has experience in sports, and also with a physio who can help you reload. So choose the activities cleverly and help you understand how to monitor your pain, that you don't overdo it. Because it's all about, with this condition, it's not about pushing through pain. You've got to respect the pain and you've got to train it at the right level to allow that bone to recover. Excellent. Hope that was useful. Take care.